Now we know nursing homes are hotbeds for coronavirus outbreaks. About a fifth of COVID-19 deaths are connected to them.
Yet California wants the facilities to take care of infected patients in-house. Some nursing homes have set up COVID wings. Maria Medina spoke to a resident inside one of those wings who fears for his life.
I feel like I was put in prison without being charged with anything, without any due process, and I was sitting waiting for my guards to kill me.
Steve Petker talked to us from the privacy of the bathroom at his facility. He's a resident of the Pine Ridge Care Center in San Rafael. He says the facility sealed off his ward and made it a COVID wing after he and several other residents were exposed to the virus through a housekeeper who tested positive.
And our station was closed off with ripped plastic hanging over the only one door access, and all of the people are not being allowed to leave the station.
No one is sick yet, but he predicts it won't be long because he says nursing assistants told him they are only issued one gown a day.
That gown's worn all day long, and they're rotating people, they're cleaning them, they're helping them reach up. And so people are touching that gown.
Which, in his opinion, means
if there's an active case or two in this station, every resident in the station will have it.
He says he asked the staff for masks for protection, but
I was told, no, you can't have masks. They're only for the staff.
We've been sounding the alarms literally for 6 weeks.
Dr. Michael Wasserman is president of the California Association of Long-Term Care Medicine.
Nursing homes, assisted livings, and group homes are the accelerators for this virus.
He says the California Department of Public Health has allowed nursing homes to set up COVID wards without providing enough expertise.
And they're making policy decisions that are getting older adults killed.
Dr. Wasserman's association just submitted a formal proposal to the governor on how to protect nursing home residents. It calls, among other things, for COVID-19 positive facilities to be run under an incident command structure with a centralized virtual support center and a full-time infection preventionist in each facility.
Why they're not using the experts to help inform them on how to fight this.
In a statement, the Department of Public Health told us CDPH has worked closely with Dr. Wasserman from CAL-TCM and has not rejected his advice, but rather has incorporated some of it into the COVID response work. Back at the Pine Ridge Care Center, the day after we notified management, we spotted a lot of activity. Technicians in hazmat suits showed up, set up a table outside the entrance to the facility, and then appeared to start testing some residents. The facility sent us a statement that says in part, quote, "Our center has implemented federal and state guidelines regarding COVID-19 for the protection of our residents and employees. We are meeting CDC guidelines in providing personal protective equipment to our employees along with our residents when they leave their individual rooms." Steve doesn't think that's good enough.
State of California, please put the same regulations that you put in the hospitals into these facilities, but give us some protections because we have none.